Okay. So it sounds like we're all in a good spot. So then let me introduce you a little bit more to our speaker for today. Jesus is an outreach and information specialist at AgeOptions. He works with the Senior Medicare Patrol to educate older adults about healthcare benefits and empower them to protect themselves against healthcare fraud. He conducts community outreach, makes presentations at various organizations, and participates in community events and health fairs to educate the public about healthcare fraud. Today, he's going to talk about what are the most common scams that are affecting Medicare beneficiaries in Illinois. He has information on what you can do to prevent fraud and collaborate in your community and lots of great other resources. So I am going to hand it on over to Jesus Enriquez. Thank you so much for joining us, Jesus.
No, thank you, Renee. Thank you so much, everybody, for one more time to make possible this opportunity to share those important resources. And this comes along to a very important thing to say about this because everybody, a lot of people get scammed. And a lot of times they don't know where the scam is coming from, or they are in intergenerational families and they are looking for the big resource there and they don't know where to go, or they don't know who even advocate for themselves. That's one of the first things that we all shall do, but sometimes we don't know where to go, like I mentioned before. So in the screen, we have the SMP program, which is Senior Medicare Patrol. I have to stress the information that we are funded by the government. We don't sell anything. We don't advertise any brands or anything like that. We don't do any endorsements. We give impartial information about what you can do to protect yourself. Another thing that I have to share is that we are a national program. We are also statewide in 13 state agencies in Illinois. We have a good partnership with all of them. AgeOptions also has AgeGuide as a partner agency as well. We believe in those partnerships. AgeOptions has resources for people 60 years and over, living in Cook County, excluding the city of Chicago. So we have made a lot of programs, you name it, a dozen different programs, including library, education, Meals on Wheels, community meals. We have Uniper, the ability for seniors to get connection to learning programs for where they are, if they are homebound and you cannot get out of home. So vaccination still continues for homebound individuals too, for seniors. So all of that information is available. You email me, I'll post my email after I conclude my presentation. So if there's any other questions about any other programs. So with that in mind, we do have the next slide, is that how much money is stolen through Medicare fraud every year? This is not incorrect. This is actually a correct quantity. $60 billion are gone through Medicare fraud, and then they will never recover. Only less than 1% is really recovered every year. So we are talking here about millions of dollars versus billions of dollars. So what can we do to prevent this problem to begin with? Empower Medicare beneficiaries, everybody that is in touch with them, to prevent this problem to begin with, and do something if it happens. The next one that we have here is an ad, a commercial from the program.
If you get a phone call, do not talk to the person. These people are well-trained. Don't talk to them.
They don't know me. They're just trying to scam me.
Don't be fooled. Hang up. Just hang up.
Never give out your Medicare number.
They're going to get your number to put in a false claim.
If I get a call from someone, I don't pick up the phone. And should I pick up the phone and they ask for information, then I hang up.
How do you detect Medicare fraud?
Just like I check my credit card statements, I check my Medicare statements monthly.
Scammers can get a hold of your number, order medical devices through your account, and you're not even going to know about it if you don't look at your statement. Check your statement every month.
If you get your statement and you see something that you know you did not have done, you report it. call your senior Medicare patrol.
If you suspect Medicare fraud, contact the Senior Medicare Patrol in your state.
And we do have a number where people can call and report in the tip line. They can even call the national number if they want to. There's a waiting time, obviously, for that. The national line through Medicare, or they can call our number. I'll post the chart that it has that number in addition to our helpful numbers for everybody. So first of all, before I do that, we have to talk about the most frequent types of Medicare scams and fraud in Illinois, which are the most common ones. First off, the durable medical equipment scams. So as we know, Part B as in boy covers any medically necessary durable medical equipment. And it has to be prescribed by your doctor if it's medically necessary. And that involves back braces, knee braces, walkers, canes, oxygen tanks, and even more than that. The problem is that a lot of Medicare beneficiaries might not know this information, and they might accept these from somebody that is calling. So how the scam works? A beneficiary gets a call from a fraudster claiming to be or working for Medicare. The fraudster offers a free knee brace in exchange for the Medicare number of the person. The fraudster then sells the information to a unknown company, DME company, who pays to a doctor to sign up the prescription, and they get what we call the kickback. They get money for each party, and then after that, as a result of that, the beneficiary might receive a charge from $500 to $10,000 in combined charges, and they might not even get the device, or they might get it, but it might not even fit. So some people have gotten 5 or 10 boxes in the mail, and what they do is there's nothing they can do about it. They can try to return it, but they might be unsuccessful to return it. And when they need the service, they might get denied because they already got it from the scammer. So in other words, that this is a very lucrative industry, has been scamming seniors since 80s and 90s, 2000s, so even now. So we have to tell seniors, if you really need a piece of device, durable medical equipment, you have to really go to your doctor and don't accept anybody that comes through your phone. That is absolutely a red flag. Another thing that's happening, and we're gonna see a video of this with CBS 2 News, a report that we did before, is the genetic testing scams. So some of you might not even know yet what are the genetic testing scams. So what happens to the genetic testing scams? It happens when Medicare is billed for a test that was absolutely not medically necessary. And something comes in your mind when you want to have a surgery or you're going to have something medically important done to you, your doctor might order a genetic test. It might be a typical thing they do. Your hospital, your health center might order it. That's completely fine. I'm talking about if somebody comes to you and says, are you at risk of Parkinson's disease, cancer, Parkinson, like I mentioned, you might be able to get something covered under Medicare at no charge. Well, that's the solicitation that is obviously illegal, and it's not your hospital, and you might be responsible for up to $5,000 to $25,000 for those tests. That is a lot of money, and your saliva through the cheek swab is sent to a lab and sent to a center that has nothing to do with your hospital, has nothing to do with your doctor whatsoever, and you might not get results that can be used for anything. So we want to see that video really soon, but first off, you may attend a community event. You might see a sign that says free genetic testing, and you are pre-approved through Medicare. Come here to stop for details. You get your number, the business will charge the Medicare account immediately to get those services. You might not receive the results. A lot of people have not gotten those results. And you see that Medicare has to pay up to $10,000 or $15,000. We're gonna see a video right now, followed by this, that is gonna show you exactly what has happened to some people in real life. So I'm gonna play this.
Still suffering from spine or back pain? Don't just hope for the best. Visit the #1 practice.
Breaking news tonight, 35 people are charged in a massive Medicare scam, accused of submitting more than $2 billion in false claims for bogus genetic tests.
All paid for by your tax dollars. It's a scheme CBS 2 investigator Pam Zeckman has been tracking locally for months.
Oh, here's molecular. It shows on the back. Yeah, here.
It just sounded like fun and it was free. There were no results.
No, there's nothing here.
Marge Lyons and her friend Florence McCauley went to a health fair in Oak Forest last year, like this one, and signed up for genetic testing.
We thought they were legitimate, that this was something that could benefit me.
The company they signed up with was TrueMed Test, which has also marketed its services online and to nursing homes. This year, I went undercover at the Oak Forest Fair and found a different genetic testing company using a similar pitch for screening whether you have a gene mutation that links to cancer or adverse reactions to certain prescription drugs. 3 weeks later, we went to another fair in Skokie. A different company used the same pitch.
It's at no cost to those who qualify.
But here's the rub. Medicare regulations require that genetic tests must be medically necessary and ordered by a patient's treating doctor in order for Medicare to cover them. Coverage that costs taxpayers hundreds of millions of dollars a year.
Are you a doctor? I am a doctor.
That doesn't cut it under the federal regs. And yet, there are many companies offering these tests with an on-site cheek swab, billing Medicare thousands of dollars without the approval of the patient's treating physician. Travis Trumich is with the Medicare watchdog group called AgeOptions.
Medicare is losing millions of dollars potentially with this scam. It's a huge problem. It's a huge nationwide problem.
Records we obtained under the Freedom of Information Act show that in 2018, Medicare paid more than $260 million for genetic testing. And now, both Medicare and the FDA have issued fraud alerts for this scam.
This is brand new, so we're trying to get ahead of it right now.
Here's how it works. Clients like Florence and Marge have to provide their Medicare information and health history to get the testing. Then their swab is sent to a lab that bills Medicare, and the results are supposed to be sent to the patient or their doctor. But it turns out it wasn't exactly free.
Medicare got billed, and they paid thousands of dollars between both of us, and neither one of us got any results.
Did a doctor who's treating you order the test?
No.
Were the tests in some way medically necessary?
My doctor had nothing to do with this.
Do you feel like you were used to accomplish a fraud?
Certainly sounds that way.
I think that it's a scam. That's what I think it is.
TrueMed Test lists this home in Grand Rapids, Michigan as its principal office. We went there to get some answers. The owner, Eric Winland, didn't answer the door here or at the home where this woman confirmed he lives.
He travels all the time, so he's hardly ever here.
All right.
But I can have him give you a call.
He didn't. Instead, a TrueMed spokeswoman said it's a marketing firm for the laboratories, and the labs are responsible for sending out test results. No comment on whether TrueMed is violating Medicare regulations. Records show Wendland has violated federal regulations before. In 2011, he pleaded guilty to defrauding the Department of Housing and Urban Development by falsifying loan documents for unqualified applicants. He was sentenced to 42 months in prison.
I'm shocked.
I'm flabbergasted. I just can't believe it.
Sue and Robert Hall say they also can't believe what Medicare paid after Wendland talked them into signing up for genetic testing last year.
$20,000. Never in a million years did I think they were going to charge such an exorbitant amount.
Their lab bills were paid even though records show the ordering doctor is a nurse.
And it's supposed to be a treating doctor. The workers who are approving these things, are they not trained to spot this?
After constant calls, the Halls finally got their lab results from two different companies. Did you understand the reports?
Nope. I had no idea.
So we asked this expert in genetic testing linked to prescription drug reactions to review the reports.
This is like the Wild West, where a number of companies have sprung up very rapidly that are claiming to be able to do this for far too many medications right now than have evidence, like the reports that you have in hand.
What's the risk?
The risk is they might go stop a medicine when perhaps that medication is working really well.
And this certified genetics counselor found serious problems when she reviewed Hall's lab reports on genetic mutations linked to diseases.
Only 3 out of the 12 genes that they have associated with pancreatic cancer are actually associated with pancreatic cancer.
And
they're missing close to a dozen genes that are associated with pancreatic cancer.
For other diseases, she found similar errors in the reports.
I would consider them useless for a patient.
We're worried about Medicare always, that they're going to run out of money.
That's right. For the things that people really need.
After our interview, Marge decided to call Medicare to report they never got the test results Medicare paid for.
Welcome to Medicare. We're currently experiencing longer than normal hold times. In a few words, briefly tell me the reason for your call.
I'm reporting what I think is a scam.
Thank you. Your response will help us make future improvements to our automated system.
But first, they needed her birth date, so she gave it.
I didn't get that.
November.
So she gave it again.
I didn't catch that.
What the heck is wrong with you?
Okay, let's continue.
Not
Your estimated wait time is 10 minutes.
10 minutes? All right, I'm done. I'm not doing it.
After our inquiries, Marge and Florence finally got their test results, but don't understand them. The labs did not answer our questions about their marketing and testing methods. The labs and TrueMed and their owners were not among the 35 people charged in the billion-dollar genetic testing fraud indictments announced today. The feds say their investigation continues. But Brad and Erica, the real question here is, why doesn't Medicare get this fraud before it reaches millions and billions of dollars that we're never going to recoup?
Right.
And so basically you saw that it's just happened in several days. People get scammed and they happen in public events. This is back in 2019. In 2020, we have variation of the scam. It was using your cardiologist to let you know that you have to get genetic testing done in order to perform something with cardiologists. So that's a sort of scam. Right now, it's evolving to doing cancer screening testing as well. So the genetics testing is here to stay. The thing that you saw about multiple charges, molecular charges, or any other words that don't even make any sense in the summary and statements, those are charges combined that total up to $10,000 to $15,000. One piece of advice to Medicare beneficiaries is never accept anything that says pre-qualified under Medicare, or anybody claiming to tell you that it's covered for free. It's not even your doctor or your hospital or your provider. We have another scam that has happened the end of last year and the whole time this year. It's called the urinary catheter scam. There's going to be a video and we will back.
According to this Cash App card I found, I'm Nurse Mallory Jones, and I'm about to buy.
NBC5 responds with a new warning about a growing fraud that's targeting one of Illinois' most vulnerable populations. Taxpayers lose billions of dollars a year to Medicare fraud.
And here in Illinois, that means roughly 20% of Illinois residents who rely on Medicare may be left without access to the critical medical services that they actually need. NBC5 responds PJ Rendawa shares one thing you can do right now to find out if scammers are profiting off of you.
The numbers are pretty shocking. According to the Centers for Medicare and Medicaid Services, the government spent almost $950 billion on Medicare funding in 2022. But according to the Department of Justice, an estimated 6% of that, or $60 billion, went straight to scammers.
Medicare fraud happens when someone bills your Medicare account for something you didn't receive or for something that wasn't prescribed by your doctor.
I looked at it and I saw urinary catheters. PJ, 2,000 urinary catheters were billed.
For retired nurse Linda Hennis, it was catheters, $15,000 worth of them that she didn't need and didn't order.
I've been on the giving end of a urinary catheter, but never the receiving.
Linda says she noticed the charges on her Medicare summary notice earlier this year. On it, you can see 10 separate charges for catheters from a company called Pretty in Pink Boutique out of El Paso, Texas. Linda found their website and another piece of the scam.
Up came the site with this huge disclaimer. If you think you're calling about, if you're calling about urinary catheters, you may have been a victim of Medicare fraud.
The boutique's website says they've received dozens of calls from people like Linda, and they are not the ones billing Medicare for catheters. They say there are at least 5 companies registered with Medicare that share their name, but their boutique doesn't even sell catheters.
A lot of them are just shell companies, and they're out of business real fast. They make their money and then get out real fast.
Travis Trumich with the nonprofit AgeOptions says other devices often used in the scam include knee or back braces, but catheters are the most popular. He explains how these Medicare billing scams usually begin.
So what happens is that a call center from overseas calls the beneficiary. They get their information from the dark web or a data breach. They call the beneficiary and confirm all their information. And once they get that information, they sell it to a durable medical equipment company.
Linda reported the scam to Medicare immediately. Even though she wasn't billed directly, she knew she could face consequences down the pike if she didn't.
If your Medicare is billed for a device or equipment at some point and paid for, and then later on you legitimately need that, they can deny it.
It doesn't really hit the consumer unless they need it later in life, but it really hurts the American people because of all the tax dollars wasted.
Here are the key takeaways. Never share your Medicare number. Beware of unsolicited phone calls asking to confirm your medical information. Medicare will not call and ask you about that. Now, keep records about the medical services you actually received and monitor your Medicare summary statements. This also applies to those who have private insurance and receive explanation of benefits summaries. It's on these notices you're most likely to find out if your insurance information has gotten into the hands of a scammer. For more information on how to report Medicare fraud.
And it's the same way as we check our credit card statements, right? Everybody does check your billing statements the same way we should check our medical statements to make sure we're getting billed for the right thing. And if there's anything that obviously doesn't make sense, like urinary catheters, some people really need them for sure, but a lot of people do not need them. Like Linda was a retired nurse. She's a professional, managing all the stuff, keeping logs and everything. A lot of people are not. So what we have to empower them is to keep at least take a look, maybe not keep a log of everything, but at least take a basic look in your receipt or summary notices to make sure there's nothing suspicious there. But I'm more advising here in this matter. Don't give any of your personal information, including insurance information, social security numbers, to somebody that you don't know. Trustworthy healthcare providers are not going to sell information over the phone or just via solicitation. Door-to-door marketing, telephone marketing are a sign of fraud. Don't give your social security numbers in exchange for any free services. As we know, there's those text messages that ask for your social security number, or emailing even looking to get your social security number and commit identity fraud on you. They should never need that information if it's free. We are talking about glucose screenings, cholesterol screenings out in the community. Those are funded by reliable sources, so they will definitely do not need your insurance information. Do talk to your doctor if you need any supplies or services. Your doctor should order those devices and supplies if it's needed. The Medicare summary notice. Can you believe that some of the seniors that I ask about, did they get their summary notice for Medicare? They have said, I don't get anything. Well, that might be the case when they sign for paperless. When they pick a Medicare Advantage plan every year, they sign them up for paperless. So that's why they don't get their statements sent to their home. But if they call their company or they call 1-800-Medicare, they can request documents to be sent to them. And I'm actually telling all of them to do that. even if there's nothing suspicious, it doesn't hurt. It doesn't really just hurt to look at it. We have to watch for services and supplies that you didn't receive, services not ordered by your provider, and other errors. So that's kind of scary, right? Like the Pink Boutique was actually a place in Texas that was used to fish somebody else. That's a little concerning. So they might even use that in the future, who knows? But knowing that this is happening and just talking about it, mentioning something, a Medicare beneficiary mentioning something, segment mentioned how is Medicare not doing anything really about it a lot of times. It's because we need more Medicare beneficiaries to speak up if something happens to them. So the number to call and report a problem with your Medicare fraud, suspicion of fraud, is 1-800-699-9043. I'll keep sharing this number. And we have also Adult Protected Services Agency, AgeOptions. And they ask us to share these slides with you. They are very helpful. Financial exploitation means the use of an adult's finances to the disadvantage of the person being taken care of. And a lot of times it's the family member or the provider of their care at home. So the most common one is withholding the money, not paying their bills, misusing the credit card, and stealing property. So basically misusing their financial information and resources. And obviously it's gonna lead to neglect, unfortunately. So how do you go about reporting financial exploitation? If you are in Illinois, all of us are, we have a 24-hour Adult Protected Services hotline that's available and open 24/7. You can call and make a summary of what's happening, and you can make an anonymous report. You don't need to leave any of your name or phone number, but you can make an anonymous report. Any suspicion of financial exploitation. And if you live in Cook County, excluding the city of Chicago, services.ageoptions.org, it's a website where you can type an address and get the office closest to you that can take a report. Also, if you're looking for a meal site or a meal supply for a senior available to them, that's also a good site to look at that information about too. So the Regional Long-Term Care Ombudsman is the person that advocates for people in nursing homes. For suburban Cook County, we have the number. For the city of Evanston, we have that number. I'll be sharing this PowerPoint after the presentation with Renee, so she has that information handy. But not knowing that it's important to have these numbers just in case something happens. Oh, okay, yes, you have a question? I think I have a question on the chat box. Somebody has a question?
Milton. Oh, you're muted still.
Okay.
Give him a moment.
Thank you.
There we go.
Yeah, my question is, when we call a bank or a credit card, there is a procedure that we go through as a consumer to verify who we are to help eliminate scams. So why isn't Medicare putting in some type of device to ensure that it really is me calling in asking for a catheter or some type of test versus these people who say free when Medicare is not putting any kind of buffer in to verify that I am a legal physician that can order this equipment?
That I might not have an answer to you. That might be a question for Centers of Medicare and Medicaid Services.
Okay.
They have a community liaison on Center of Medicare and Medicaid Services. I'm really not sure, but that's a good observation, though. There should be a filtering mechanism. But yeah, Center Medicare and Medicare Services will be able to answer your concerns. I agree that will curb fraud and that will curb a lot of issues. But yeah, that's actually not a question. That's actually a good advice for them. Just thank you for participating. So as we have here, we have the current scams that are happening. the Social Security, IRS, identity theft, romance scams, grandparents, sweepstakes scams, and death scams. So all the scams are just persuade you to reveal personal information. So all these are techniques that they're using to play with people's emotions to get their personal information. And as we know, the government impersonators, Social Security, IRS, will never call you or threaten any legal action or anything to like such an arrest to get information from you. And as you know, they are demanding payment that is not trackable, then that's a very red flag. Don't give any secret answer to your questions like pet names, like birth dates, like anniversary dates to anybody over the phone. Because you might think, oh, okay, you know what? They might not even be able to trace my account or know who I am. They might use those answers to get answer to your password, your financial information, just with a click of a button and strokes of a keyboard. So again, that's also revealing information. These are the numbers that I want you to have in mind. These numbers, the Equifax, Experian, and TransUnion. When somebody has a suspicion of identity theft, they can contact directly those numbers. You have a right to get a credit report of each agency for free every year. And why would you do that? To make sure there's no accounts open on your behalf. As you know, there's many breaches, like the AT&T breach, like the health center breaches, like a lot of different things that are happening. That's why we need to have protection, such as freezing our accounts, such as placing a flag in your accounts even, to make sure there's nobody using it, even if they have your Social Security number. It might be a little annoying, right, to lock your Social Security, but it might be worth it in the end, because once they use it, it's over. They can still keep building things. Also, another piece of information that I almost forgot, but I mentioned in another presentation is, if you know that you were scammed under Medicare, the first thing that you can do is get a new Medicare number. Immediately get a new Medicare number. And if you have private insurance, let them know about the new number as soon as you can. You will prevent the scammer from billing through Medicare. You might do it. If you do it the same day, you get the new number the same day, you will definitely stop them. And then you can still file a report with us. But that's important. As soon as you know you were scammed, you can get the new number. So we have those numbers that might be helpful for some of you or people you serve. I'll be sharing this PowerPoint. These are definitely very useful to everybody, really. We do have what we call the Illinois S&P Fraud Alert. These are emails, newsletters sent every other Tuesday, and they have information about scams and any information about safety related to government agencies or new fraud trends. We have a page where you can go to illinoissmp.org, one word. This will take you to a place where you can print our handouts and share it as free as you go, as you can. So, and then you scroll down and you'll have an option to register for a newsletter. And we just need to have your email from you. We don't need any where you live, your name or anything like that, or your phone number, just your email. Now, volunteering with S&P. We have around 13 volunteers right now. We are statewide, remember that. So we have 13 agencies. So on average, one volunteer per agency. We can always take more volunteers because we believe volunteers should be in the area where they're educating the people. They are a key part of this program. They can do senior affairs, community affairs, and presentations. We have a volunteer coordinator, Allison Cassidy, that can be open to take any information for anybody that wants to sign for it. One thing that I have to mention about becoming a volunteer, there's no requirement of hours during the year. You can do 1 or 2 hours, 3 hours a year, and just collaborate in presentations. And the information and details is over there. And I'm gonna leave the phone number for any questions about requesting presentations, information about reporting scams. You want to be a volunteer, for example, yeah, all that information is the same. 1-800-699-9043. Does anybody have any questions or comments?
Thank you so much for all of this information. And if you wouldn't mind, I actually, just being a social worker myself, I've actually had a couple scams that have come through that I've heard about, and some of you may have heard about these too. One that was very popular were individuals coming to your door or to the door and changing your Medicare policies. So I highly encourage anyone that you're working with to be very mindful about who's coming in, looking at their policies, trying to change, trying to bill, saying, oh, we're going to have at-home services, or, oh, we're going to have this, and they don't provide any of those services. So kind of similar to what they're talking about here in these videos is they'll say that we're going to do all these different things and then don't do anything but bill Medicare. And they used to come to me and go, fix this. I didn't do this, or this isn't the policy. They would completely change their Medicare policies, completely change everything. And then we'd be kind of stuck, trying to figure this out. So it's just being very mindful about who's coming to your door. It's very scary that this is a possibility. The other one that I think is very scary is also the options of where they will record a family member or use AI to record family member voices, or to say, hey, mom, dad, or hey, grandma, grandpa, I need this. Somebody's called me and needs money. I actually had a few individuals that had that where it sounded like their grandchildren asking for money, and they would get this fraud. And, I know that's not necessarily directly related to Medicare, but it's people that are still scamming these individuals. And it's extremely frightening. And so just keeping everyone aware that people out there are very clever, unfortunately. And if it seems too good to be true, Jesus, you probably are in the same boat, then it must be too good to be true. Sometimes that's unfortunate that, we live in that day and age.
Rennie, I just have something to say about this. Even I got a call from Xfinity today, just to share your personal example. I'm switching my account to get the discount every 2 years, and they call me and they're like, we need to authorize the user that you have. And I'm like thinking, it's called scamming. I'm researching the phone number everywhere. Like, I'm not going to call them. I'm going to go in person. So yes, you have to be more careful.
Absolutely. So thank you for all these resources, all the phone numbers. Are there any questions for Jesus and, for AgeOptions? I know we're definitely going to be sharing this PowerPoint, but is there any questions right now while we've got him front and center?
I'd like to just make a comment if I can.
Go ahead, Dr. Brantley.
Thank you. Happy holidays to everybody. We provide, our service for the seniors, and we've learned a great benefit is when the seniors, I know not all of them are in senior communities or residential buildings, but I love the camaraderie and services that are available to the seniors at senior buildings, where they can go to the director or the coordinator and ask information for advice. A lot of the seniors that aren't in these residential communities, of course, they are preyed upon, but just emphasizing the various resident buildings, they have excellent services, of which seminars, even such as this, but in their own buildings, where on certain days they can come down and bring their medicine and talk to their doctor. And it's just so important to have that, type of resource, that's available. And once again, at the senior buildings, they have so many different activities, and I just commend them for, being available to the seniors. That's how we were able to start, by going to a senior building, if you will, and speaking with the coordinator, et cetera, to see if they wanted to include some wellness services. And then, like anything else, we try to be a part of the community, go to the different events, et cetera. And that's why we've been able to see the significant resources that are available. So I just wanted to say, keep up the good work, and thank you for a wonderful presentation, Enriquez. Thank you.
Thank you, Dr. Brantley. Appreciate that. And it's true. At the different locations, there are going to be great camaraderie. There's going to be great resources. But the more that we can continue bringing these types of educational events out into the community, the better. The more that we can bring out awareness, the better. So, if you are aware, please let us know. Please contact Jesus. We'll have him put his email address into the chat, and we'll also put it in our follow-up email with everyone. Reach out, ask for those presentations.
Rini, I just want to mention something real quick here. We do have a connection with the City of Chicago Department of Family Senior Services. I know it's a very long name, right? But it's called White Creek Wellness Center. In White Creek Wellness Center is also doing events in the City of Chicago. I just thought I should mention that. So yes,
fantastic.
we can come to the City of Chicago and do events and presentations.
Awesome. See, we've got all of these right here at our fingertips. Fantastic. All right. Well, thank you again, Jesus. We appreciate it. Appreciate you, and again, shedding light on all of this. And hopefully, even if you're able to stop one, I mean, it's one person. So, it's a start. So thank you for being able to share this. I hope everyone found this extremely beneficial. And if you have questions, feel free to still add them into the chat. Let us know. But I'd love to open this up now to ask everyone to, number one, if you haven't shared your contact information and popped in to our conversation a little bit late, feel free to add that into the chat and introduce yourself. But opening it up to all of you. Tell us the great programs that you have going on. Tell us about what's going on for the holidays in your area and share with us. We love hearing that. We want to make sure we can get all that news out there. Go ahead. I see Miss Regina Hampton out here and talking about your memory cafe. Share with us. You are on mute.
Okay, can you hear me now?
Yes, we can. Welcome.
Okay, thank you. Great session. Happy holidays to everyone. I'm working with the Inglewood dementia-friendly community with our founder, Miss Deborah Thompson, along with people from let's see, University of Illinois, I believe. But we're working together to have our first official Inglewood Memory Cafe. She's calling it the Memory Board, and it will be held every month at the Lindblom Park on 6054 South Damon. And the time is 10 a.m. till noon, and it's open to Inglewood especially, but anybody is welcome to come. So it should be fun, fellowship, socialization, and hopefully some good information. So thank you.
Thank you for sharing. So you said Lindblom Park, 6054 South Damon in Chicago, January 15th from 10 to noon, correct?
Correct. I don't know if you got the invite that I sent, but I'll send it. If you didn't, I'll send it again.
I will send that back out. Yes, I did get that. You shared that with Monica and I, so thank you so much. We are looking forward to sharing that with everyone.
Thank you.
All right. And Stephanie Bailey, I see you mentioned you have an example of something that occurred out of state in relation to our presentation. Did you want to come on and share with us a little bit?
I'd love to. Hi, everybody. I'm Stephanie. I am with Caring for Caregivers at Rush. I put my contact information in the chat. We provide one-on-one support to caregivers, so direct counseling, connection to resources. I'm happy to answer questions about that program. Thank you, Jesus. That was so helpful. And my mom had something like this occur, and it was of interest to me because she knows that I do this type of work and also also doing shift counseling and trying to help people avoid that type of scam. But she had a call of someone offering her the life alert. And I have been encouraging her to get one of those. So unfortunately, they got all of her information. Of course, they initiated the call. I said, why didn't you wait and talk with your area agency on aging, like AgeOptions? That's what you need. But unfortunately, she did give her information and they started charging her over $400. Now, I was not able to clarify with her whether that was a legit company that just maybe charged her 1 year up front, but that definitely seemed really questionable. And so she was able to get that charge removed. But it took a lot of back and forth. And I just want to thank you for everything you're doing with the SMP, because I tell people all the time, and even my own family, that I've told it, I don't know, maybe 20, 25 times I've told her that, and she still, was taken advantage of in this way. So just want to put that out there. Y'all are doing great work, and these are really good, resources to share and just to keep reminding all of us. So thank you.
I know, I'm just gonna mention, like Stephanie, you probably know this, but this is something that I keep stressing to seniors is the community care program is not only caregivers, it's also the life alert device. It provides that.
Thank you so much. And I have to find out her local, hers is in Texas, and I've told her many times, but I just she needs a little, I need to call with her, I think. Thank you so much.
Awesome. Thank you. Miss Harriet Dart, I see you with your hand raised. Please join us.
Thank you. I was on the phone for a lot of it, but thank you so much. In my professional career, I could see this, what I thought were scams, and didn't know quite what to do it. But I have a question that you may or may not be able to answer, but perhaps one of the physicians has. And Stephanie, I may contact you. My daughter has moved in with her uncle, who suddenly became a widower 3 years ago. His wife died suddenly with a heart attack. And he's not very tech savvy, maybe getting some memory issues now. And he's had 2 bouts with colon cancer and surgery with it. And so when he saw his Medicare, they ordered a CT scan, but the prescription says for patient reassurance. Should I follow up with a physician and say that's Medicare might not want to pay for it if it's patient assurance? And who would who on the call can answer my question? Is that you, Stephanie, or Jesus? Is that you?
I was gonna say, Jesus, you might have any guidance for Harriet on directionally where she should start?
It sounds like she needs to contact the provider, because there's a question that I have about that procedure, about if it's needed or not. It doesn't really sound like a possible scam. It sounds like she needs more clarification about what is going to be.
Right. I don't think it's a scam. It's perhaps a clarification in the diagnosis and that. But professionally, I will get to what I thought was a scam. I was a certified pet orthopedist for 40 years. And as our organization helped encourage Medicare to pay for preventive care for diabetic footwear. And then as someone who took care of mostly extremely complicated cases rather than the simple prevention. And then when I would get into, I was a chaplain at a senior center, and on the elevator was the sign that said free shoes. And I know, having gone through all the paperwork for getting the prescription and everything that's required for diabetic footwear, which the program is wonderful, but doesn't that, it seemed this fell into the category of soliciting business. What would one do? Take a photograph of that poster and send it to you?
No, so I think they have, let me find you the page.
Thank you.
Where you can report this to the OAG tip line for the public. Oh, there it is.
And I know that, there were people that went door to door looking for opportunities.
Mm-hmm.
And oh, thank you.
Yeah.
Yeah, it's amazing how many people have gone door to door or just what people are doing nowadays. So I'm glad that you're being vigilant in this space. So thank you. Thank you for sharing those those questions, those experiences, and we appreciate Jesus trying to give some guidance there because that's scary. I think it's even more scary when you don't know where to turn or you don't have the resources to turn to say, can you guide me? So appreciate
Right.
being able to have this safe space. So thank you.
And we don't get paper copies of our Medicare benefits, which would mean once a month check into the Medicare site, right?
You have the ability, and Jesus, I know he was speaking a little bit about this as well. You have the ability to receive the paper copies, even though if you've selected, to go paperless, you do have the ability to get into your account and to be able to go in there and receive that and log in and review everything. So that's something that you always have that option.
Thank you.
Mm-hmm. All right. Any other resources? Any big holiday events coming along? I know it's a Monday and the Monday before the holidays. But I just wanted to see if anyone had anything else to share. Okay. Thank you, Dr. Brantley. I see you sharing here a little bit about the holiday program schedule. Everybody moving and grooving still with the holidays. That's fantastic. All the body part senior fitness programs. Love it. Thank you so much. I appreciate you sharing all of these. These are going to go into our email. I'm sorry. Who did I miss?
No, I was just saying thank you because sometimes our class is too early in a sense, or it's not on the day that's convenient for some of the senior members. It's only twice a week virtually, Wednesday and Friday. However, I did put underneath our picture that's at the museum, actually the Griffin Museum of Science and Industry. They have their Christmas lighting up of Christmas around the world. So that's a beautiful time to go there and check that out, especially I used to put Christmas tree up, but my kids are so grown now that I go visit other places that put the trees up. So Griffin Museum of Science and Industry does just that. But I just wanted to say that last link are pre-recorded videos. So you can go to the library at any time at your convenience and select what you might want to see and participate.
Okay. That's important. That's wonderful. Thank you. Those are some great resources. With it being we've got the Salvation Army Ray and Joan Kroc Center Memory Cafe, Friday, December 20th, coming up right around the corner, with some holiday cheer. And for those living with dementia and their care partners, Monica, you wanna share a little bit more?
Yeah, I was typing really fast. The time is from 11:30 to 1. I didn't want to interrupt anyone, but it's Friday the 20th. We're going to share some holiday cheer with the care partners of people living with dementia. And I know it's a little chilly, but I think Friday's going to be a pretty pleasant day. So hopefully people can come out to the Kroc Center. And I'm so excited about hearing about other memory cafes. The flyer is going to be too big. Now we're going to have to get a poster board with all of the memory cafes. So Regina, I did not see that email, so I apologize for the redundancy, but I hope to get the information for it to continue to share it out to others.
Great, thank you.
And thank you, everyone. But before we go, as the year draws to a close, we just want to express our sincerest gratitude again for all of your invaluable contributions to the aging community. Your passion, your dedication to providing all of these essential resources and programs and education has truly made such a significant impact on not just the older adults, but the community itself. So we appreciate, from the Share Network, we appreciate your partnership. It's been instrumental in sharing our mission of promoting healthy aging spaces and improving the quality of life of all those that we impact. So we thank you for your unwavering support, your commitment, and we hope that you have a joyous holiday season and a prosperous new year. And with that, we'll see you in the new year, everyone. Take good care. Happy holidays.
Bye, everyone.
Bye, everyone. Be well, be healthy, be fit, be wise.
Thank you.